Good afternoon, everyone. We are on day 50 of this pandemic, if you can believe it. So Premier is going to give us a very quick update. Dr. Patterson is going to speak and clarify some things, and then we'll get right into questions. Thanks.
Unusakut ulunga 50 ulerturte me tukus manivut sivulertur khalimakay na laulunilo ta Patterson o khalimakay na lang amayo aperso sitakwe.
Luciano mute we hupunga waktu luang mahulita kuota na nuban na 19 nunavut iluaning imat ublumi mutikid lugo 580 kawi haktaw himayut nuban na 19 kangi mangata 219 uli kawi haktaw yut mata ko 361 kawi na to nuban 19 kangi tut Amatana tuhagaka tana no public health emergency nukta kaya mangilap ng kutana tuwang nato anya tayo dito sinakay takligato himayo tana atong May 14 mo tikid lugo mahan na ulak tutakwa ilin na tutubut ilin na kani tuniyaw talang mata ilin na wing me takwa ilin na otikat iluani pilere kau yut ilangi hanat tali atau hamu ilangi hanat tali mahunut takini me piyut takwa ilinna otikat takwa ayung iningit okalima na mi na hailering mi na kanginak mi amma timi mut hungit charnak takwa iluani tut amma takwa ilinna otikat kayuhin na tana ilinna with ukyong at ihon at tukid lugo tana ilinna ve ukwa kemayo le takihani takwa ilinna law patatana ihulib vekiano tikid lugo takwa ilinna otikat tuniyaw tanan amma takwa ilinna otiyu takwa ilinna tutin ikayok tut kihani ilinna ukwa law lugo ayungin niya na ayungin niya takwa tuniyaw taktut ayungin ningit takwa ano A B C D takwa tuniyaw tamata ilin na tut ayungin ni tan na ukwa tilugo ilin na vi tan na tuniyaw law to ayungin niya nanunay ko taktan na hunni lang ito kihani takwa ilin na ko tikat ikayutit ilin na tun amma uwamnik amma Nunavut government ngini mat na awak tunga takwa ilin na piliriyut takwa ilinna tutit tibni ikayut sa mata ilinna tiyit amata ko ilinna mi pilar yumat na pakka amatuhang naktalam matakwa kabdunano na ni tabo aviktok himayut ano ukwa padle lang mata la ihumang mat kano ukwa padle lang mga tatakwa pilare kat nang minakak takwa aluit Watcha otana ilwa kay mga Dr. Patterson unika na man Nunavut mili huna na maglakpakihan iti apigara yang mga ta matakwa Nunavut mi kawi makoyakka takwa akol sa Nunavut miut anya kong islugit hungitsa ko slugit akopta kihanita mapta Nunavut miut lukta takwa ikayok tigiglo ta kihanita na anya dilang inapta atau ya katigilo ta ikayok to katigilo ta na anigong na may matnaw yuhe. The English version. Good afternoon. There is still no confirmed case of COVID-19 in Nunavut, and I'm always happy to say that. Today, the total number of people under investigation to date is 580. We are still waiting for the results of 219. And 361 people are no longer under investigation. And as a public announcement, the public health emergency is being extended until May 14. Many students have now received their first at-home learning packages. Most of these packages include work activities for 1 or 2 weeks to strengthen their skills in literacy, numeracy, health, and well-being. Families should expect learning packages for the rest of the school year. I want to remind parents and students that these are designed to reinforce the skills students have already learned and will not be assessed by teachers towards the final mark. On behalf of the government of Nunavut, I want to say a huge thank you to all school staff for supporting their students during these unprecedented times. Across the country, provinces have started unveiling their plans to lift restrictions, so I will ask Dr. Patterson to speak briefly about what needs to happen in Nunavut before this can happen here. We are all committed to keeping Nunavut youth safe and well, and let's all do our part. Thank you.
Thank you. As many of you know, some jurisdictions in Canada have started or will soon begin gradually lifting the restrictions they have implemented to flatten the COVID curve. Today, I'd like to speak in more detail about what needs to happen before we can do the same. There are 3 conditions that need to be met before we start relaxing our existing restrictions, and they are as follows. Number 1, we need to achieve in-territory diagnostic capacity. This means that we need to be able to implement a rapid, accurate, and comprehensive COVID testing program here in Nunavut. Number 2, there needs to be significant indication that rates of COVID-19 are decreasing in southern jurisdictions to which Nunavummiut most often travel. And number 3, there needs to remain no active cases of COVID-19 within Nunavut.
Amisulus kayimayut sa uliratsi ilang yawit si maniuyo ka na tamihalo na nipigiak sa malangata o balupigiak palyalalangata kasu si palyan ang mod isulit takbiyo titaw unik atulak titaw si mayunik siyang mapalya kunagunuvat joam na amisang palya si maningin ulumiyo ka sa kakumayong analo na iyak lugit kanuiliok to kakayak mga tay may gunak sinayakot ta pingasut malitaw gaya kakayak to takwa ismasaksyo taw laungin ningin ni pik taw niyam ningin ni sulit takbiyo titaw yun Nunavummi ukuang ubot. Number 1, tamani Nunavummi kawi sa kutitakalirluta imatuk ilik atulak titsig gaya kakayak tugut sukat tumikilamiyo yukut tam maksimang itunik atangyak tunilu nuvadyo anak 19 mi kawi sa kutinik tamani Nunavummi. Amalo number 2, Dalu na si may laki galik ta ko katsiw ning inovadyo anak 19 ta si may ami katsi na ko palyalang ning ni kaluna ni abitok si mabiyo ni Nunavummiut aw lak bigay gayot tangin ni ang maluping ayoat tamani inovadyo anak 19 ta kagayat hangit jangit tok Nunavummi ta magko kasuyaw palyalang nakata.
The nature of these conditions means that it is difficult to assign a specific timeline to reopening, but fulfillment of these is necessary to minimize risk to public health and safety. We need to know that Nunavummiut traveling outside of the territory can do so safely, and we need to be able to respond rapidly to any confirmed cases of COVID-19 within Nunavut. I know that people are eager to go back to work, visit loved ones, and engage in social activities. However, if we lift these restrictions too early, we will increase the risk to Nunavummiut. If we aren't careful about how we transition back from these restrictions, we could effectively undo all the hard work and sacrifices that have been made over the past 7 weeks. It is as important as ever that we stay the course, maintain social distancing, stay home when possible, and wash your hands often. These measures continue to be the best defense against COVID-19 and the best way to protect our families, our communities, and our territory. Thank you.
Tako ilulingit malitaw yaga hakayak tu ayong naktu ya tu galwan nalo na kasualo ya hangak kulata matu palyaga yang mangata kisa ni tako pingaso malitaw lekata uluga naktu mitit si kunata kikutu inamnik hayo magya hakayak tu talo Nunavut sila taano aw lahat taktot at tanang ito ko aw lahat takot naksakulugit. Ang malukila miyuyukut kamagyaha kung lahat takayak tigo nalo na yung tao yung kanuvad yung anak 19 Nunavummi. Kaya magaluak ito nga takwa kayong ilaktui kanaya kaya kumayo ito balo pula kaya kumayo naligay ang minik o balo ino katigini kaniuli yung katika kumalakto galuat. Kisani li taakua khasugiartao pata isulitarbiutitao yokhilami uluartukkut ulureanartumiititsilirajaqatta Nunavummiunik. Ujerssut saangikkuta khanu uterpallianiarmangaat tatamaaktaakkunanga isulitarbiutitao yunik. Taakku atsuruutigissimayavut tuniqqutigissimalaortavulluaq pinasuarusiussimayunik savannik atuutiqarunniituinnaqajangata. Pimmariuvuq maanna pimmariunerpaanguluni taimaitsainnertuinnarta inuuqatigiiqanigiiluaqattarngillutik angeqqarsimat qattarluti taimaigunnatuaruvit aggatilluwaasainnaqattarlugin. Taakku malittaugialiit sulia kaunerpaanguyut akirartuutiulluti Nunavutjuannar 19-mik ammalu sapummili jutiutsiaanerpaanguyut ilattinnik nunaqqatittinnik Nunavummiunillu.
Ken Driscoll, APTN National News. Dr. Patterson, now on Monday you spoke about groups of 5 or fewer people as one of the things you were outlining for Nunavummiut. I was wondering if you could explain that a little more. Can a family of 4 invite one person over? Can a couple have another couple? I'm wondering if you could put a finer point on what exactly that 5-person limit is.
Ken Driscoll, APTN Kunik, Luta Patterson, Tagna Nalunailautena, Gajami, Talimai, Tunganiluni, Nunavummiu, Katiratarunam Naralilavigit, Hanalunai Kanero Sulu. Ilagi sitamaulu teatau semere kuyigunnakat ubalo ay pari makuilingaluti katigunnakakano ilingabataman.
When you're out and about, it could be either one household, which could be bigger than 5 under many circumstances, or one family that lives together. But if you're mixing different households together, it's 5 people. So 2 couples or 4 people from one family and one other person, that would fit within those rules.
Anilutili lagi kallimayong atanos magunnartuugalo at kisani takwa pularatigi hattarunnar sigunnalaong atayla solo ay pari makulingaluti katigunnarluti kubbalo sitamay ilagit ataw sumihaykuyilutik tayo matagkatallimanalunat taw simabut tayo may gunnarningani.
And the rules in personal dwellings or private dwellings are essentially the same, that there could be up to 5 different people or the residents of the house in cases where the house is occupied by more than 5 people.
Takwa ato agay solo ang kakayaw yun itay maitsay ng mayo solo talimaw na kataw nga tanong lunit tako talimaw nga tanong sumagun ng mayo.
So if 4 people want to invite one person over, is that okay or is that only for outside?
Solo tako sita may kaya ko yung mapatataw sa may ang kakayaw yun mo kano yung gayang ito balo sila mikisan.
That is acceptable. It's still less than 5 visitors, and so there's no problem with that.
Itay mga kano yung gayang ito tayo na kaya ko yung pat talima tunga nilaw to ako.
I should say legally no problem with that, but we would still recommend that people keep visiting down to the bare minimum needed.
Maligapti ko tayo mga kano yung gayang ito galo kasi ani pula kakatam ni taman na sulip pula galo kakata ko yung inata suliman.
Coin the meek for the interpretation. One more for you, Dr. Patterson. Last week, we talked about the flights from the south that contained both quarantine travelers and essential workers. Now, you had said then the hope was with some better scheduling, that could be reduced. Are the flights still running with those 2 groups together, and are they being separated by at least 1 full row of seats?
Luta Patterson, tako hangata yu ukaw sa riyo gawigitay ko ino tu tao katak tu jo me vimitu tamalo tamang ano na bumutak palle ayo asingit ataw chiku katalangan ni kayo gawigita ko ataw chiku kat hangata katala kasuli sulat etsibaw tangin unga sige kalawatilogi.
Thanks. Unfortunately, not consistently, at least with one flight path, and we have been taking it up with the airline. And if it's not where it's been a strong request, if it's not followed, then we will issue an order making it mandatory to have the travelers fully separated. With travelers now wearing masks, it does reduce the risk, but we still want to maintain either we want to maintain separation either in time or space.
Taana teimei laringittu suli taana piloartumi hangata viuhattartu ilanganni hangata juulerikko uhautissima javu tammaluun teimei kunnanginneraqhata nalunersilaartugu asiaguorbehangilluni teimeigia hartillugi tamakkua hangata hattartu immikku hattarullugit taima searmarsiqunagin.
Rajani Sharma, Nunavut News. Dr. Patterson, you just mentioned that there are three restrictions that need to be met in order to, there are three requirements that need to be met to lift the restrictions. I was just wondering, can you provide more details as to what you considered decreased rates of COVID-19 in the South? Like, what exactly are you thinking about that?
Rajani Sharma, Nunavut, Pival Julerikuni Luta, Patterson, Uhakaugo Vitako, Pingasut, Nalunatao Patatako, Hoyanatao, Valegun Nalegayangata, Maliktao, Karutauyut, Dana Ilanga, Hatsino, Palala, Katakan Lunani, Upatao Gayut, Tohano, Tamana Tokili.
Thanks. For that one, the requirement or thinking the requirement should be that they're on the downside of the slope. So they've passed the peak and the numbers are steadily decreasing.
Tamanna tukili malittau gelik suullu katappalle katahatsiuningi amisoaluilla ollutik katappalle katahatsiuningi tamanna tukili.
And you said there were specific places in the South that have to show this decrease, right? The ones that residents of the territory may travel to. What are those places exactly?
Nalunay kaugavit kako halunani nunavummiu pagayuttangi nalleango vatakkoan.
Quebec, Ontario, Manitoba, Alberta, and Northwest Territories.
Quebec, Ontario, Manitoba, Alberta, Malununatsia.
Sorry.
Just one last question. Is there, the three things that you've listed, is there any flexibility in like dropping one of them in the future, or is it really strict? All three have to be met?
Tako pingasunalo na kauyati ilangi malittaw gatong ilat asiago biu kun nakad o balutako pingasutako sakir si maglaki kaya halo tikisian yung kayaka.
Sorry, just thinking of how to word it. I guess under the right circumstances, we could say 2 out of 3 is not bad, but 2 out of 3 could also mean needlessly increasing the risk to Nunavut and undoing all the hard work that people have done over the last 7 weeks. So I'd have to be, we'd have to be firmly convinced that the other 2 are rock solid before we give up on one of the others.
Akaw na tilogo imakoy na pingasuli ngayon ni kanoy kayang gitu galwa. Kisani ulungan ak tumitit sigumangit sa katatako at suru tigisima yavu tunik ko tigisima laoktavu pinasako sinisabanik. Kuya na tao tuin na hungin akit kisani tako tunga vikat sa luti tako nalunay tao si mapatay ilang kuya na tao si matuin na kakaunak to tako malitaw gali.
Emma Tranter, Nunavut News. Dr. Patterson, just seeking some clarity on the revised order that was announced on Monday. What was the reasoning behind revising that order? Did it come from some of this pressure we've heard from people like the Canadian Civil Liberties Association? Where did that decision come from?
Emma Tranter, Nunavut Connecta, Natokisinatige, Huyutana, Sigilau, Tili Sijutikisimayate. Sumasijak tao talaw ka tako kanatami piyon na tilay ko ayaw tuilong ningin no asidjilok.
The biggest reason was that it was impractical for a longer duration, and some of the things that need to happen were technically illegal under the old order. So if you had a problem with your washing machine, you couldn't. It would some strict interpretation would have said nobody could go in to fix your machine and things like that. So we had to let some people in, and we had to set a number that seemed reasonable while minimizing the risk. And across the nation, 5 seems to be the lowest or the most conservative in terms of managing the risk. And we felt, given our lack of diagnostic capacity, that keeping as low as seemed reasonable, or as low as possible, seemed reasonable.
Tana piluannarpaangu yupidsutinga taana hanok malittaugasaaluni ajornalaungat alla maligarnissirumitsilaunga piruyatohaulaortuni suullu waasauti annoraano siruminneqa teikkoa madiltugi isirunnartoqalaungimmat kisaani aaqitsilu taqatsinik isirunnartunin palu katimagunnartunik taima tallimat tukiratuujaangunnerpaangulaunga taanalu kanatami atortaugajoqattarsuni aulatsinermut uluqianartumiititsiqunagi piluartumilumaani nunavummi qauyissagutitaqartinnata taanna malituinnarsimayavu.
And a follow-up to that, I'm wondering who is responsible for writing out these orders? Is it a collaboration between Departments of Health and Justice? Can you tell me a bit more about how those words actually get written down?
Taana ilagiarlugu kikku kamajuuva taanna tutiqartauqattarninga tutira ila tilisijjutiujoq aanne harnangittuliqiyikkut maligaliriyikullu taanna qanu katirsortauqattaqqa.
It's a back and forth between myself and other staff in my office and the Department of Justice, lawyers there. Sorry.
Ila utauqattartu taatsumunga ammalu eqqanayartinginnut ammalu maligaliriyikkunni maligaliriyini kajortauqattartu titiqartauvallaatilugu.
And then going back to what you just said this morning, or this afternoon, sorry, about the 3 things that have to be in place to ease restrictions. I'm wondering if restrictions are eased. I think some people are worried about tourism, especially in the summertime. In Nunavut, we get a lot of tourists here. Have you given any thought, I guess, to tourism in the territory? Is that something that might still be restricted even if other restrictions are lifted in terms of travel? Any thoughts on that?
Taana pingasuulinga yuni qausiqaqqaugaviit atagiaqaqajarninginni taakua quyanaartauvallagunnaliqqat gajaliqqata malittaugiahartitaujut taana pulaqattulirinni piluartumi aujakku amisu tamaungassuungummata issumagijaulauqqaa taakua suli issulittarbiutitaugajarmangaata taakua assingi
The border restrictions will be the last restrictions to be lifted, and we would, the cruise ship season has already been canceled by Transport Canada from sometime in February. So it's still going to be a very small number of tourists, even if we did completely lift the restrictions. But we haven't gotten that far into it to even think about that. That would be probably at least a couple of months away, if not longer.
Taakua killingi isulittab ila isaqtautailuviutitauju kingullerpaangugajanga taanna quyanaartauninga taakua le kanatami ingeqqajuuleriyerjuakku quyanaarsigiilarsumaju February-utillugu teikko umiarjua pulaqattini tamaunga tikititsiqattartu tikiqattajaangitsaammarittu aujakkut taana issumagijauluarsimangittu taqqiiqqaimaqqu naappatikkisaani nalunaertaukannerunnalaartu
unali apereqqaaraartara Canada limaami kapamagijauju kuiqqalleeleq matatuhaqtarsutigulu Kano piballeneeleq mata Nunavut milli huna ukkueqaaqajaqpa ukkueqpalleneelernerpata. My first question is with the other governments across Canada, other jurisdictions starting to open their services to Canadians, do you have an idea of which places in Nunavut would start to open as you decide they can open now?
Oh yeah, don't need the translation. Sorry. We're still mapping that out to get it so that we open up the ones that are needed the most and have the lowest risk of spreading COVID-19 if there happen to be cases involved. Daycares are at the top of that list, but we're figuring out which ones could be added to that as well.
Taana sulinailunaijortauvalliajoq Tako piyaw ga khalakin nak pa ese masaksyo ko tigi gayak tabot ulo ga nak tumitit si taili guna nak pa si amagun nak ninganik. Tako pa ribi si bulak pa wakataw gayak tut amalo ese masaksyo tugunan leta matwik tayo palagun na lagayak mga ata.
Nata periyaw yo takwa Nunavut minubak yanang nektakang nitlugu nubak yanang 19 takang nitlugu huli Nunavut mi kano ukwe tak pekuyakang na ma ukwe tak pale na tuni Nunavut mi takwa luatuk tao na kritikihe ni nubak yanang ne kayuhinang ne kaktaw ma ukiw ni kainak tuni takwa nalunang mailangi nubak yanang nang maatuk tao himanak mata kayuhituin nang naksunilu Nunavut ukwe tao tuin na umakpa kawi magalwag lohi tana kayuhinang ukiw ni kainak tuni in your list of requirements needed before Nunavut could consider opening up, you said there needs to be no active cases, but we expect people to continue getting cases for the next few years. Would contact tracing or still having sick people quarantine, would Nunavut consider opening up even with a few active cases?
You mean opening up in Nunavut?
Yeah.
No, if there were, let's say in the next couple of weeks, before we've eased those restrictions, or next week we find that there's active cases or cases of COVID-19 in territory, then we would hold off until we've made certain that they're isolated cases with no evidence of transmission within the community or communities where those cases are located.
Tako ali tamani no badyo anak to halaki talan na khata ko kingo variak to gayak to is khasuya walagun nam ningi mal sa magum nam ningi tama ko kise ne khawi maguti ko ta ko no badyo anak to li sa masidjang ningi ni ta ko suli khasu walagun na gayak to malik taw kakti tamo.
My next question is, I'm not sure if it's for the Premier or George Finance, but I wanted to know if there are still a number of people that are expected to come to Nunavut, and how many they are, and how much would you say it's costing you per 14 days? Tana perituin naman na ko inuktitu takwa kablo na nunangit ni tamo nga Nunavut mo tikiti tawag na to 14 ni ublo ni utakaw ka kakmata kano akitu ba ang makapiw ba man na yu utakiti taw himayu. Just to go back to this, there is a bunch of people down south for medical reasons, and they are spending 14 days in hotels, and you're also feeding them. Could be costing you a lot of money. Do you have an idea of how many there are every 14 days and how much it's costing you?
Basically, thanks for the question, Jordan. And we don't have exact numbers of how many residents are outside the territory. There's not like a check-in or check-out list that we have. We do hope that anyone with the intentions of returning to Nunavut in the short term have registered with the CPHO travel requests email address.
Kaya na may Jordan na perigabit katsilat tangong mga tatako ano na bumoy utirumayo kaya mga Iqaluit tutigo kisya ni tako atiliw si mako naktugalo tek palego yan gumayutan na angayok ngatangan na hamang itulirikot awla ko manang mo hakisaw yakutut siya kautingag.
And one of the challenges with giving exact numbers, Jordan, is they do change day by day, especially in the Ottawa hub, where we do have a wait list. So as soon as a room is available and it has been cleaned to the standards that we expect, then somebody else would come in. So there are people that are coming up regularly as their 14-day isolation periods do expire.
Tāna tsurunang ngaila si jitakpat suni ulutaman piluatumi arawami ta suminga tuttabiuyumi illugusi atu inarutuarai matataiko takkiyutaiko nga illugusernuuqtau hattartu ila upinnaqani salumarsartaut sialaortillugit taako ullui 14 naagai matatai maatikippallianginnartu taikani tuyurmivimmiittumini.
And just in closing, and it's basically the same thing with our medical traveler patients. As they get cleared to travel, that's when they would enter the isolation period at the hotels at the isolation hubs. So the numbers vary on a daily basis. On average, we've got approximately 200 people through the medical travel process. That seems to be kind of a fairly consistent number. We have, as everyone is aware, restricted non-essential medical travel. As our partner jurisdictions start opening up some of their healthcare facilities and treatments that will be available, we'll have to adjust with that as well too to deal with our wait list for medical travelers.
Tema China tako anna beliartuti aulla khattariali tema hanuigunni nirartaugeemat utirunnarsinirartaugeemat tatako tuyurmivimmu tauhattartu inutu kuvinginnut tako alu hatsiuningi asijirtainarngata kisiani 200 ngugayuttu itamakko anna beliarsimayu kamagikhattariali vuullu tamaat tako alu hallunaani matuyurpalliali khata tikippiugunnarning aullarpiugunnarningillu Sulu anna bingi at matuyurpalliali khata qigiaraa kharajarmiyavu tamakko taqimmata missu anna biliariali.
Unatta tukihiga chaawaqtaqa qikariaq torlunga qablunanunanga nuqqangayaq tortuulaaqpunga amma ubluni la qangan ma uteroaleruma Nunavut government kunu aperilek lunga aigualek dunga manukang ditawlek lunga 14 ubluni. So my question is, if I wanted to go on vacation and go down south to maybe shop or do anything I want today and write something to the chief medical officer, would I be allowed that, or is that completely off the list?
Thanks, Jordan, and appreciate the opportunity to clarify that for the public. With our initial travel order, it was strongly recommended that all non-essential travel be eliminated, and that's still in play. So again, we're not a police state where we basically won't allow you on the plane, but I can't stress enough on how important it is for people not to travel right now, even interterritorial, even within the territory. People need to really stay at home and continue to social distance, and that is what's going to continue to keep COVID-19 out of the territory. If you do not need to leave the house, if you do not need to leave your community, if you do not need to leave the territory, don't.
Okay. Kuyenna mi piwa hatti tauga matana tukisinakti tauga khullugu tana sivullerpaamin alunaattawalorsimayo pidjutillari hangilluti aullari hanginnerartauju suli taana atammat aullakatat luaqujinginatta suli kisiani inuusilni aullarsijillarialunginatta ima hangatajummi ikititsittaili nirmitaima pijunnaute hangikkaluartugut kisiani aullaqattaqujingillaritugu suli alla Nunavu iluaniugalo asinginni nunalinnut angeqarsimallari hujituinnartugut inuuqattigiillu hanigiiluattaili khullugit tamanna nuvajuarnar 19 isihunagu Nunavummut taima suli uqautuivugut angeqarsimatuinnaritsi nunatsinniituinnaritsi ammalu Nunavummiituinnaritsi.
Ken Driscoll, APTN National News. Minister Hickes, I want to go back to the airlines and the quarantined and non-quarantined passengers flying together. You paid the airlines $9 million last month. Shouldn't that buy you at least one row of seats in between the quarantine and the non-quarantine passengers. I'm wondering, why are the airlines taking so long to meet the requests of the Chief Public Health Officer?
Kentrisko APT and Kunnik Minister Hickes tako hangata yuli mitsano tako alo anitaili titaw si mayo tamalo Nunavut motak palya yo asingit tako akili yo got $9 million ni takyo law to me tako akili tigir sa mangimata tako itsivauta ini hangit tweet avitsima vigayak to sumali tako malit titaw jangila ana hamnang itulirin ng mga yok tilisid jutigis si mayangani.
Thank you. Sorry about that, Kent. I was just clarifying something. As Dr. Patterson has stated a couple of times now, we're working very hard with the airlines, and I do realize, again, with the compensation that we've been providing to keep them sustainable, to maintain the scheduling that they're at, is obviously not cheap. That being said, they have been working quite closely with us as a government as well as with Dr. Patterson's office.
Luta Patterson uhahatak si mama tako pili hatigit siya tavo hanga tayo lirikut akilir sulaw takalawo kata tuin na kunagit namin hati uningit makita kun nat siya hulugit ang malulok siuting asid jilo ako yunagit taman na akikitong imad ang malo pili hatikat siya nga tawan ni kamalo Luta Patterson me lalo na kaya ako matuin nataka.
Yet it still is a concern. Anytime, and that's been one of our goals, is to not only separate them by plane load of having essential workers on one flight, residents on another flight is our objective in this. We do recognize that there may be circumstances where an essential service worker has to travel, needs to get here as soon as possible, and with the plane loads, when we're looking at having to take advantage of the seats that are available on a plane that we are paying for, to maximize the impact of that at the same time. So it's obviously a struggle and a balancing act, but we will continue to work with the airlines, and they have been receptive to working with us. We want to make sure that all travelers are doing it as safely as possible. And just in closing, I guess, as Dr. Patterson mentioned, with the federal regulations on having to wear masks of all passengers, does help alleviate some of that concern.
Sumalo to sulita man na kisani lang toka gagati ko tako embit ko nga titaw katakulugi pimario yun kanaya leuter palayot amalo Nunavut mute tako ilan ko pimario yun kanaya le tamang at sa tigi katara hangata amalo hangata yumi ni hakata tayo mapiyum naktitaw katangata itsivawtani ato naktakatu katako akilik simagatigo galwa. Kisani tako pila hatigit sa naktavo hangata yuliri tako utik palego mayutik palea hatako na hulugit at tanang ito ko lugar naktimitit si taili luta tanata luta kausari kau yang government hak kumaliga lari lau tangat matuak si may nakaham tanap ulugar naktimingin nak sautit Sergio si mamiyo galwa.
And my last one's for Dr. Patterson. Dr. Patterson, the Prime Minister mentioned today during the virtual Parliament, he was answering a question from Andrew Scheer, and he said that Health Canada has approved 15 new COVID-19 tests. I'm wondering, are any of those tests, to the best of your knowledge, you only said it this morning, ones that you've been considering or hoping for Nunavut to get that in-territory capability?
Tana king ulak palo ta Patterson mapik kutinga tana ngayok khabjo kanata me kiyok kham Andrew Scheer mo pek sokta luni ta ko kanata me anna hanang itulir yakjo ko ang sisima mata 15 nik nuta ni khaw yisarutini ta ko khaw yisaruti ilangi atur naks atur na kaya nga ismag bigi.
Yeah, there's of the 15 that have been approved, there's two that there's one that's definitely appropriate for Nunavut. That's the Gene Expert. We have some a limited supply of cartridges in Iqaluit right now. We have some on the way to Rankin Inlet. The next one is the Spartan Spartan cube device. That one is designed to be a point-of-care device that could be done in any health center that we have. It's still being evaluated and having the kinks worked out. The process works when it's done under very rigorous conditions, but those conditions aren't applicable to health centers. So the National Microbiology Lab in Winnipeg is still evaluating that device. And the third device is the one by BioFire, which is another analyzer intended for medical labs like we have here in Rankin and Iqaluit. And we're still hoping that one gets approved in the near future because it would also be very useful for, not just for COVID-19, but for diagnostic capacity long after COVID-19 goes away. Sorry, I should have shut up earlier.
Taakkuninga 15 nangertausima uniik taakkua makku Nunavut motoraangat searunnartuuk atortaugunnat seaqajarsutiik atiqarsuni ilanga gene export tamaani eqalunni atortaugunnarsisimajoq ammalu aipaaq kangersinermuurtaunaartuni taannattau aipaas Spartan miatilik haviisarutiuju atuutiqat searunnaqajarmijoq nunalinni aannearbinni Kisani taakkua malittaugali malittaut seartillugi atuutiqat searunnaqajarmimmat taannalu auersimi miqaujisarbi Winnipeg miqaujisarpalliaju taanna BioFire tamaanik atortaugunnaqajarmanga kangersinermi eqalunnilu nuvadjuanarmutu ina atuqunnar ila asinginnuttau qanemannarna atortaugunnarsigajarmimma kinguniagu.
I'm a transgender Nancy News. I think I asked this question a while back. I'm going to ask it again for an update. Has anyone in the quarantine hotels been, I know people are being screened for COVID-19, but has anyone actually been swabbed and physically tested? And I would also like to know if anyone has tested positive.
Nema trantununa sekunni taanna perikkannerumajanga taakkua qatujormivimmi aniteilititau jo qaujissartau qattaqqa qaujissarutinginnillu taakkua nuvadjuanartuqarmanga taqaujijoqalaorsimava.
Yes, people have been tested, including going to sites for getting swabs collected, and so far none of those tests have come back positive.
Qaujissartau qattarsimaju taikkununga tujormivinnu upattaullutik kisaani taakkua nuvadjuanartuqariangi nalunaertausimajoqangittersuli.
Things not to say. I should have shut up earlier.
Yeah.
I didn't mean to almost give you another hat.